Hey, welcome back. This is Paramedic Project. Thanks for joining us once again. And today we are expanding on one of our life-saving skills, laryngoscopy. And I wanted to talk about two important points to start off before we actually start performing the skill. That's some of this foundation knowledge that we need to know. First of all is about the equipment we use to perform the actual skill. So the first bit of equipment is the laryngoscope. So the important thing that I like to do when I'm checking this equipment, a lot of people just open their airway kit, they'll look in, check that the button works, check that the light shines. What I actually like to do is I like to pull it out of the kit, hold it in my left hand every single day that I check this. And that's really important because this is a left-handed piece of equipment. It doesn't work in your right hand, it's designed to be used in your left hand, and it's designed for you to be able to get a view of the patient's vocal cords when you use it in your left hand. So it's very important to start concreting that neural pathway. This is a left-handed piece of equipment. So my suggestion is every time you check the equipment, take it out of the kit, hold it in your left hand, and just so that when the pressure's on, you're going to perform this life-saving skill, it all runs smoothly, and we've got those neural pathways concreted in place. So that's a really important first step. Second bit of equipment is the Gills forceps that we often use to actually clear the patient's airway. So these bit of equipment, once again, it's highly specialised. It's designed to be used in a particular way. In that particular way, it looks like a pair of scissors, but it's not designed to be used like a pair of scissors. We actually put our thumb and forefinger through the holes, and that way it actually goes in our hand, and we can insert it into the patient's airway and actually extract pieces like that. So same as for the laryngoscope, when I check this bit of equipment, I pull it out of the kit, put it in my right hand, and actually put it in the way I'm going to use it when I'm performing the skill. That way I start concreting this neural pathway with my right hand, which allows me then to really do that highly dexterous work of removing pieces of food or a small bit of plastic or whatever is blocking the patient's airway. So start concreting those neural pathways early with this highly specialised equipment we're going to use to do this life-saving skill. So there are two really important points about equipment. Third most commonly used bit of equipment is the Yankow sucker. And once again, this sounds like a no-brainer, but usually this is a right-handed bit of equipment because you're doing other things with your left hand, like using a laryngoscope. Start picking this up with your right hand when you check it at work. Start actually covering the hole you need to cover on it to provide suction. You'd be surprised how many times I've seen people put this in a patient's airway with the suction noise going on in the background, assuming it's actually sucking secretions and fluid and contents. But it's not until you actually cover that. So it's important to actually practice these things. Even if we're not physically putting it in a patient's anatomy, it's important that we're actually getting this in the right hand, starting to concrete those neural pathways every time we check this equipment, so that when we come to perform the skill, it'll be very smooth, it'll be seamless, it'll be successful. So that's what we're all about. So that's the first thing about equipment. Second thing is about anatomy. This is foundation knowledge you need to know. I think the best way for me anyway to get the anatomy down is to be able to draw a cross-section of the patient's anatomy. So that's a cross-section of the patient's upper airway, probably with 15 to 20 labels, labelling the important points, including the molecular groove, the epiglottis, the glottic aperture, the esophagus, all those big bits of airway that we can see when we actually perform the skill of laryngoscopy, are things that we want to actually move out of the way and displace with our laryngoscope blade to gain the view, and then things that we want to avoid like the teeth and things, because obviously that laryngoscope can do a lot of damage if it's used in the wrong way. So they're my two big points as far as starting off with this skill of laryngoscopy. Thanks for joining us once again. This has been Paramedic Project. Find us on social media, and there'll be a couple more episodes coming up about laryngoscopy as well, so be sure to join us for them. We'll expand more into my tips on this potentially life-saving skill.